This Sunday will mark 25 years since the FDA approved a revolutionary drug to help people with leukemia. And the man credited with developing it is the head of OHSU's Knight Cancer Institute. Christine Petewanich spoke with one of his patients and sat down with him to reflect on his achievement a quarter century later.
Side effects have been almost non-existent. He's given us our lives back.
That's Jim Logan, a leukemia patient that KGW interviewed in 2001 when the FDA approved the drug Gleevec. Fast forward more than 2 decades.
It's been amazing.
It's still making a difference.
Gleevec is a game changer. It saved my life.
Oregon State Representative Hai Pham, who is also a pediatric dentist, was diagnosed with chronic myeloid leukemia, or CML, when he was 27.
Well, I still remember like it was just yesterday.
That was almost 20 years ago. He is one of the many patients whose life has been changed by the groundbreaking drug.
It's given me a second chance at life, having the opportunity to get married, have a family, and coming home to my young children, right? Who's like, "Daddy, Daddy!" All your stresses just melt away at the end of the day when you walk through that front door.
That's just amazing. And there's just hundreds and hundreds of stories like that about people who are alive and thriving despite that diagnosis of cancer.
That's Dr. Brian Drucker.
I'm the CEO of the OHSU Knight Cancer Institute.
He developed Gleevec, which changed the course of cancer treatment. Sunday marks 25 years since the FDA approved it.
Some of those original patients that had been told, get your affairs in order, are still here 25 years later. And today, when I meet with a patient, I can tell them with confidence, I expect you're going to live a normal lifespan.
The daily pill turned CML, a once deadly cancer, into a manageable condition.
Before Gleevec came along, if a patient got diagnosed as leukemia, they were told you've got 3 to 5 years to live.
Drucker's discovery was revolutionary and paved the way for other similar targeted therapies, where the medication kills the cancer cells, but not the healthy ones.
There are now literally thousands of these targeted drugs for lung cancer. There was recently a story about a pancreatic cancer targeted drug that's doubled life expectancy. That's what we've accomplished thanks to the work that we started here at OHSU with Gleevec.
And Drucker says with more than 600,000 people in the U.S. dying from cancer every year, the work is far from over. And when it comes to CML,
before I retire, I'd really like to be able to cure it. You know, to take it from well-controlled, taking a pill a day, to completely eradicated.
But at least for the moment, he's basking in the glow of the milestone, celebrating with the patients who he now sees more as family.
They were the true pioneers because maybe they felt they had nothing to lose, but if this medication didn't work, it had side effects, that could have been pretty costly for them. So I'm truly grateful to patients who believed in me, believed in what we were doing.
Yeah, so many lives saved by that drug. And by the way, when the FDA approved Gleevec about 25 years ago, the concern was that there wasn't much data on long-term effects. Well, now a quarter century later, Dr. Drucker says they have found the drug is well tolerated with very few, if any, long-term side effects. Christine Petewanich, KGW News.